Many of the genetic abnormalities cannot be diagnosed by routine ultrasound examination, for which further evaluation by other tests is necessary. We suspect genetic abnormalities only in certain cases where a woman had repeated abortions, or in certain cases where there is history of abnormalities in previous pregnancy or family history of abnormalities. In such situations, after doing the other tests, at times the patient may be asked to undergo certain invasive tests. These invasive tests that we do are amniocentesis, chordosynthesis, or chorionic villus sampling, in which case you pass a needle into the abdomen of the mother and take a sample of amniotic fluid or the cord blood for examination. This is done under local anesthetic care, in which you infiltrate some anesthesia into the abdomen of the mother and pass a needle and take the fluid or the blood from the fetus. The complications of this procedure are infection and bleeding, and at times it can result even in abortion. Hence, this test cannot be done unnecessarily, but in cases where the risk of continuing the pregnancy is higher than the risk of abortion, the patient has to undergo the examination. The fluid or blood that is collected is examined in the genetic laboratory, and you can look for any chromosomal aberrations which can diagnose the abnormalities like Down syndrome and other similar genetic lesions. As you are aware, many of the genetic abnormalities are not correctable, and hence, if diagnosed early, the pregnancy needs to be terminated. For this reason, the examination is usually done before 5th month of pregnancy, as abortion being done in late pregnancy is not possible, and that can result in more complications. If everything is normal, the patient will be asked to continue the pregnancy, and of course the patient has to have routine antenatal examination at intervals, where the doctor will assess the growth of the fetus clinically as well as by scanning methods. As I do, ultrasound study does not have any complications. However, it is said that if you use high power sound waves, that can result in certain complications of the eardrum of the baby, and hence unnecessary use of sound waves for diagnosis of fetal abnormalities is not justifiable. For this reason, in early pregnancy, the Doppler scan, where you use higher power sound waves, is not preferable unless otherwise indicated. Doppler scan is a method where you use the sound waves to assess the blood flow in the blood vessels. In early pregnancy, you can assess the blood flow in the veins of the baby, which will give you an idea about the possible development of later complications. But this technique is still under research, and hopefully that will add more information about the healthy status of the fetus in utero in future.